Hello, my name is Justine Awudi Esnam. You are watching me and I'm giving health educations, okay? I'm giving health education. I appreciate your time taken to watch, share, like, and also subscribe to my YouTube channel. I thank you and I appreciate everything you have been doing for me. Once again, season greetings to you, okay? So today in my video, I'm here to mention some few complications that has to do with pregnancy. I will be also talking about what? A pregnant woman with rhesus negative blood carrying a baby with rhesus positive blood. And then I'll mention some other things too. So some of the complications that has to do with pregnancy, we have diabetes, gestational diabetes. Most people don't have diabetes, but once the pregnancy comes, the pregnancy induce that condition. Most and then another one too is hypertension. Most people don't are not a known hypertensive, but once they get pregnant, the pregnancy end up bringing all these things. And then infection. Most women suffer a lot of infection because once they are pregnant, pregnant women becomes what vulnerable. They are open to infections and diseases anytime. So they suffer infections also. Miscarriage in other way we can also say spontaneous abortion. They experience stillbirth, they also suffer depression and anxiety. Most women don't even have support system during pregnancy, and sometimes through the stages of pregnancy and then the pains that comes with it have a effect on them that makes them go through depression and anxiety. And then we have a preterm labor as well. Okay, when it is not time, but something like that has to happen. That is what the preterm labor is. Okay, so a mother with rhesus negative blood carrying a baby with rhesus positive blood, it's so dangerous. Okay, I'll just tell you some process right now. And this process, we call it what? Sensitizing events. And this sensitizing event happens when the resource positive blood of the baby enters into the mother's resource negative blood. Okay, we call it what? Sensitizing, or the positive the resource positive blood of the baby mixes with that of the resource negative mother's womb whilst baby is in utero. We call it what? Sensitizing event. And this happenings leads to a condition in the unborn and then the newborn known as what? Hemolytic conditions or hemolytic disease of the newborn, which is also known as HND, the short form of it. Okay. So when we as the health professionals, we have this kind of a pregnant woman or a client that comes to us, we educate you or we talk to you about the anti-D vaccine for you to prepare for it because particular vaccine too is expensive. So we earlier on educate you and talk to you about so that you start preparing because at 28 weeks of gestation you'll be giving the first one, and then at 34 weeks second one will be given. But the most effective or the best gestation to give this anti-D vaccine to the pregnant woman is between 28 weeks of gestation and then 30 weeks of gestation. But the duration is 28 weeks of gestation to 34 weeks of gestation. So this is what we encourages you to do. Let's look at, and then also this vaccine is not only given during pregnancy, it's also given after birth. After birth. And after birth, it is given within the hours of 72, you should be given this vaccine. Okay, and then this vaccine, it is given to prevent woman forming antibodies. Okay, it's to prevent the woman forming antibodies that will that will attack the red cells of the baby positive. Sorry, I'm saying that we give this anti-D vaccine to prevent the woman's antibodies forming attack against the baby's red blood cells of rhesus positive. Okay, so this is the reason why the anti-D is given. And then let's look at some of the effects or some of the complications the baby might suffer if this anti-D isn't given during pregnancy. Okay, your baby might suffer severe anemia, your baby might die before you give birth to it, or your baby might have risks of what? Brain damage. These are the reasons why we either give in pregnancy or just after. We give in pregnancy to prevent your baby from dying, prevent your baby from suffering from anemia, prevent your baby from what risk of having brain damage. Okay, that is during pregnancy. And then we give it after birth within the 72 hours of birth to prevent the woman forming antibodies that will attack the red cells of the resource positive baby in the future pregnancy. So you are watching my video and I'm teaching you something concerning what a mother with resource negative and then a baby with resource positive blood. So let's look at some other complications that has to come with resource negative birth. One, your baby might suffer hydrophytalis, that is a fluid buildup and then swelling in the body. There might be brain damage due to high level of bilirubin, and then there might be problem with mental functioning, hearing, feeding, speech, and then seizures. Okay, so please don't just watch my video and go away. I have more in there to bring to you. Most people lack the knowledge of this, and most people are ignorant of this. People are there, a lot of pregnant women there with negative blood, they don't know what to do, or they don't seek for help from the right place. Please, you are watching me, give it a like, share, comment, and then subscribe to my YouTube channel. Until then, see you.